Hi, Dr. Khan here. Today we're going to discuss the new guidelines for treatment of severe migraine attacks in the emergency department. This is the first update of the guidelines since 2016. The American Headache Society has issued these new guidelines, and the purpose of the recommendations are to improve the outcomes for people that need to go to the emergency room with these severe attacks. First, let me say that when people need to go to the emergency room because of their attacks, it tells us that our headache prevention and our headache rescue plans are not working as well as they need to be. And my patients and I need to work together in clinic to update our plan to prevent the need to go to the emergency room. That being said, sometimes you need to go to the emergency room. So the updates are very interesting to me, and I didn't expect the A-level recommendations, which are the strongest ones. Now, the first medication recommended is actually COMPAZINE. COMPAZINE works in something called dopamine-antagonist, and we've long known that it's helpful, but it has reached A-level. The second A-level recommendation is greater occipital nerve blocks. So that one really surprised me because I have a concern that many of the emergency providers aren't trained to do this block where we inject 10 cc's of medicine in the back of the head. It is highly effective. Some cautions are sometimes people have panic attacks with COMPAZINE. If this happens to you, please let the staff in the emergency department know, because there are anti-anxiety medicines that can be given to people so that they'll feel better if that panic attack does happen. But yes, COMPAZINE is a really good drug. So let's move on to the level B recommendations. The first medication recommended is IV Reglan. Okay, it is a medicine for vomiting, but we also know that it works for migraine. And then the second level B recommendation is anti-inflammatories like Toradol and the related drugs. So yes, these are excellent things to use. They have to be applied to each individual person. Some people can't have anti-inflammatories because they have other medical conditions. Another level B recommendation is an injection of sumatriptan. It's a strong, excellent migraine-specific medicine that can be delivered by injection. Now, the third one really surprised me. It's a supraorbital nerve block. Okay, there are two little holes right here in the skull above our eyes, and they're recommending injecting right there. Okay, I've done this a lot, and it is quite painful for people, and I don't know how many people will really tolerate that during a big attack. So I think the guidelines are helpful. They have a lot of evidence. We want to be able to treat people effectively when they're in these crises. Interestingly, the guidelines recommended that we no longer provide Dilaudid in the emergency room because it doesn't work that good and it's potentially harmful. So I think the addition of these nerve blocks is really helpful. This needs to be carefully applied to each individual, and the emergency room personnel needs to be appropriately trained and comfortable during these procedures. We're going to post a link to the full guidelines from the American Headache Society Journal for anybody who wants to take a look at that. Thanks for listening.